Hello, my name is Dr. Adnan Yousaf, and today we will start our third lecture. This is the page from where we left yesterday, and now we will continue from here. So, what is this? These are the cranial nerves and vessel pathway. So, this is a basal side of the skull, and it is showing from which foramina or which underlying structure the nerve and the vessel is passing. So here is the anatomy, and here are the structures from where these cranial nerves are passing. So anterior cranial fossa through ethmoid bone. There is a cribriform plate. You know already. I know. Within cribriform plates, the fibers of the cranial nerve 1 pass. Olfactory nerve. This is the only nerve in the anterior fossa contains only nerve. So the middle cranial fossa, it has one, two, three, four, five structures. The optic canal by which the ophthalmic artery and the cranial nerve 2 passes. Superior orbital fissure, from where I think a lot of structures passes, which is cranial nerve 3, cranial nerve 4, cranial nerve 5, and cranial nerve 6, and the first branch of cranial nerve 5. So, the other structure is the foramen rotundum, from where cranial nerve 5, branch number 2, passes. Then foramen ovale, from which the third branch of cranial nerve 5 passes. Foramen spinosum, from where middle meningeal artery passes. Middle meningeal artery is a very important structure in the neurology and CNS. So you should remember foramen spinosum. Then the posterior cranial fossa, internal auditory meatus. Auditory means something which is related to our hearing. So cranial nerve 7 and cranial nerve 8 passes. The vestibular nerve, from vestibular nerve you can understand the structure which are the part of middle ear, which we call vestibulocochlear structures in vestibulocochlear nerve, and the cranial nerve 7, so you should remember it too. Jugular foramen. Jugular foramen, yes. From this structure, cranial nerve 9, 10, 11, and jugular vein passes. Okay. Hypoglossal canal. This is the canal structure from where the hypoglossal nerve, obviously the name indicates, cranial nerve 12, hypoglossal nerve passes. Then the last one and the biggest foramen, foramen magnum. From here the brain stem, the spinal root of cranial nerve 11, and the vertebral arteries passes. Yes, these are the anatomical structures, and these are the nerves and the arteries which passes through these structures. You should remember it, at least the important ones. So the next thing is cranial nerves and arteries. These were the vessels pathway, and these are the mainly related to arteries. Yeah, the cranial nerve 1, and then the optic nerve, midbrain, and the medial side and from the medial side arise the cranial nerve 3 and cranial nerve 4. From lateral, Mm, there is cranial nerve 5 and cranial nerve 6. Cranial nerve 6 from the medial side, pons, and cranial nerve 7 also from the lateral side, and cranial nerve 8 also from the lateral side. Medulla. From the lateral side of medulla, we have cranial nerve 9, 10, 11. And from the medial side, we have the single cranial nerve, 12th cranial nerve. So these were the nerves and these are the arteries. We already know this is the anterior cerebral artery. The artery which is connecting to anterior cerebral artery is the anterior communicating artery. And then we have the artery which is very close to the optic nerve, the ophthalmic artery. Then this is the middle cerebral artery, yes. And the artery which is connecting the posterior cerebral and middle cerebral is the posterior communicating artery. Yes, the single side branch is the anterior choroidal artery. And this branch which is going posteriorly is the posterior cerebral artery. This is the basilar artery, and these are the labyrinthine arteries. This is the main structure here is the basilar artery, and with the basilar artery differentiate or divide into vertebral arteries and the posterior inferior cerebellar arteries and the anterior spinal arteries. So, very complicated structures, but you should have some concept about these structures. Cranial nerve. This table is very important. There is the nerve and its number, then its function, and which type of uh, sense it carries. Either it is sensory or it is motor and mnemonic, with which you can remember it. Some say marry money, but my brother says big brain matter most. Wow. But you know that brain doesn't matter. The marry, the matter the most, which matters the most is the money. I think so. By seeing the current situation. So the first one, olfactory nerve. Olfactory means olfaction and it is related to smell. Only cranial nerve without thalamic relay to cortex. So you should keep it in mind. It is sensory type. You already know our nose don't move, our nostrils don't move, our nasal septum don't move. So it is the sensory nerve. Some, yes, the word some sensory. Optic, yes. Optic as it indicates ophthalmo. So it is related to our eye. The second number, it has the function of sight. It is sensory and it has a mnemonic too. Oculomotor, this is the third cranial nerve. Oh, again, oculomotor means it is related to eye but have the addition of motor. So it is involved in the eye movement. It supplies the superior rectus, inferior rectus, medial rectus, and the inferior oblique. Papillary constriction, and it has a role in accommodation by supplying the ciliary muscles, and eyelid opening by supplying the levator palpebrae. It is motor in nature. Trochlear, the fourth cranial nerve, it is also associated with the eye movement, so it is motor in nature and it supplies the superior oblique. Trigeminal nerve, yes. There are three main branches of trigeminal nerve which works a lot. The trigeminal nerve. It is involved in mastication and facial sensations. It has three divisions: ophthalmic, maxillary, and mandibular divisions. Ophthalmic division, which supplies the cornea, and maxillary division, and then the mandibular division. It also has a role in somatosensation from the anterior two-third of tongue and damping of loud sound as it supplies the tensor tympani. So the next nerve is abducens. It is the sixth nerve, and it is involved in eye movement. LR6 means lateral rectus. It is motor in nature. The next nerve is facial, seventh cranial nerve. It is involved in facial movements, eye closing, orbicularis oculi, which closes the eye, auditory volume modulation as it supplies the stapedius, taste from the anterior two-third of tongue, and from by coda tympani, lacrimation, salivation, submandibular and sublingual glands are innervated by the cranial nerve 7. So vestibulocochlear nerve. It is involved in hearing and balance. The other nerve is glossopharyngeal nerve, ninth cranial nerve. So the glossopharyngeal nerve, it is also involved in taste and sensation from the posterior one-third of tongue. It is involved in swallowing and salivation as it supplies the parotid gland, monitoring carotid body and sinus, chemo and baroreceptor, and elevation of larynx by supplying the stylopharyngeus muscle. It is also both sensory and motor in nature as it senses the taste from the posterior one-third of tongue, and by motor means as it elevates the pharynx and larynx. Vagus, 10th cranial nerve, taste from the supraglottic region, also involved in swallowing, soft palate elevation, midline uvula, tucking, and cuff reflex, parasympathetic to thoraco-abdominal viscera, monitoring aortic arch, chemo, and baroreceptors. A lot of functions. You should keep it in mind. So the next nerve is accessory cranial nerve, which is the 11th. It is involved in head turning as it supplies the trapezius and shoulder shrugging, sternocleidomastoid and trapezius. It is motor in nature. The next and last one is the hypoglossal nerve, tongue movement. It is involved in tongue movement, so it is also motor in nature. The next thing is cranial nerve reflexes. So these are the reflexes which are related to cranial nerve, and by showing these reflexes we can find any abnormality related to any kind of nerve. So accommodation, it is related to optic nerve, and it receives signals from the optic nerve and effect via the cranial nerve 3. The corneal reflex, it is related to trigeminal nerve and receive its afferent from the first branch, which is ophthalmic, and or nasociliary branch of trigeminal nerve, and effects via the cranial nerve 7, temporal and zygomatic branches, and it supplies the orbicularis oculi. Cuff reflex, it receives its afferent from the cranial nerve 10, as we saw here. Cuff reflex, and it also do its function by the cranial nerve 10, and also phrenic and spinal nerves. So gag reflex, it is related to cranial nerve 9, and it receives its signals from cranial nerve 9, glossopharyngeal nerve, and functions via cranial nerve 10. Jaw jerk, it is related to cranial nerve 5, and the main branch which is involved is third branch of the trigeminal nerve, which is sensory and muscle spindle from the masseter, and it also functions via the cranial nerve 5. Lacrimation V1, loss of reflex does not preclude emotion and tears. It functions via cranial nerve 7. Pupillary reflex, it receives its afferent from cranial nerve 2 and functions via cranial nerve 3. So the muscles of mastications, there are three muscles which close the jaw: masseter, temporalis, and medial pterygoid. You should keep all these three in mind. The lateral pterygoid protrudes the jaw, and all are innervated by the mandibular branch of trigeminal nerve 3. Are innervated by these all muscles are innervated by trigeminal nerve. Are you hearing me? Sorry. What is going on here?